Melanie.
And I'm Cheryl.
We want to welcome you back to Wine Time with Women.
For women.
Just to recap what our last talk was about, our introductory episode, we talked about the anatomy of the woman's vagina and things that are important. If you didn't catch that, we really would like you to go take a look and just to be familiar with what we talked about.
Anatomy and when to see your first visit, your provider or OBGYN, nurse practitioner, or whatever, for your first visit.
So today we are talking about breaking your GYN cherry. You are a GYN virgin and you are coming for the first time to see us.
This is for you.
What should you expect? This one is for you. And I'm going to actually ask Cheryl to tell us more about that.
So when you come in, you obviously, we kind of a quick recap of the first video is if you are sexually active, or if you're having issues with bleeding, pain, discharge, anything like that, come see us. Or when you turn 21 is when you're going to start doing annual cancer screening for cervical cancer. So this here is the speculum. People call it the duckbill or the contraption. What else have you heard? We hear it called all different things.
Yeah.
They come in plastic, they come in metal.
They come in different shapes, different sizes, and different manufacturers.
Yes. Usually the metal ones we try to heat, at least at my office, we do heat them, which is nice because sometimes the metal ones can get cold.
What I like about the plastic, however, for personally, there are some of the plastic ones that actually have lighting devices that plug into the bottom. And
some plug in. This one is kind of handy dandy, and you just pull tab, and then
isn't that fantastic?
I know,
you can
nice.
really see, and then you can see the walls of the vagina, which is really awesome. However, people report that this is a little bit more uncomfortable than a metal, which seems kind of silly, right? You would think a metal would be more uncomfortable.
I think it's personal preference. I don't know. Sometimes I notice that I think the regular metal ones, regular sized or the medium sized metal ones, and there's different kinds and different lengths and different widths, but the normal kind are a little bit smaller than this medium plastic one. But we can use lubrication. Sometimes these tend to go in a little bit more difficult, but they do give us a better view of kind of what's going on because it's clear and we can see all around the vagina.
So, how long does that last, that light?
I don't know, because what we do is just pull this out and throw it.
Well, let's leave it and see.
Bin.
That'll be fun.
It definitely lasts long enough to do an exam, which only takes a few minutes.
Which is a really important point.
And to reiterate on our last video, if it's your first exam, do your best to relax. Makes it so much easier on both of us. The vagina is a muscle. If we're trying to get this in and you're like, oh, so tense and nervous and scared, take a deep breath. Try to relax that muscle. Relax your pelvis so that we can get the speculum in there. It is a muscle. When you tighten it, it makes it harder on you and me, and it's going to be more painful. So when you relax, everything's easier.
And when we do ask that you definitely, I know it's a natural instinct when you're being touched in a very, very sensitive area. The vagina is rich in nerves and blood vessels, and it's meant to be that way for a reason. But you automatically do this. Do your best not to, because that too, the clench and pull away, obviously again, tightening the muscles, closing the legs, not going to accomplish the goal of getting a good exam in there. So tell us about your first visit. So we know that if you're having, you have a 16-year-old that comes in with some vaginal itching, very common, she's not going to get what a 30-year-old sexually active woman is going to get. Let's cover that.
Yeah, there's different size speculums. If somebody who's never been sexually active, there are different size speculums. We do have pediatric ones that are probably the size of my pinky. So they're much smaller.
And is it necessary sometimes for a child to come into a gynecologist that you need that? Yes, there are reasons for that.
There are reasons.
Different episode, but there are reasons for that.
Yeah, there are reasons, but typically if you've never been sexually active, I try to stay away from that area. have a yeast infection, we can insert a Q-tip and just look, and that's usually not invasive. Like, we can stick a Q-tip in there and check for yeast infection.
Or BV, too, as well. Bacterial vaginosis.
So a pap smear. So when we insert this into the vagina, we're looking at, we get this little spot and open this up, and in there is what we look through, and we see a cervix. And the cervix looks, the best way to describe it for me is kind of like the head of a penis is how I kind of describe it.
Like, so I would describe it as like a
donut?
donut. Yeah, it looks like there's a bunch of, and like there's an indent like a donut. When you're looking at the side of a donut, that's what it looks like to me.
Okay.
And everybody's perception of it's going to be different.
All right. So the cervix, this is what we see when we're opening. The goal is to look at your cervix, see what it looks like, see if there's anything abnormal looking, and then we take a little brush or a cyto brush or something to take samples of that cervix. The cervix, we have, I don't know how well this looks, but the cervix looks like this. I don't know if you guys can see, but it looks like this. So we take the brush and get samples, just a little bit of samples on this.
Now, are you talking about an affirm?
No.
Talking about
for the pap smear.
A pap. Okay.
For a pap smear.
Sorry.
So we just get samples of the cell with just a little brush and just kind of like, almost like scraping, but it's not really scraping. It's skimming, I guess.
Think of is it similar, you said, to a mascara brush?
Yeah.
Yeah. So think about taking a mascara brush and just, skimming it across those margins to detect it, to collect any cells, to see what's going on.
We send them off to cytology that checks for any signs of abnormalities and potentially cancer cells.
And there's many different things that you do at the visit. So let's talk about those, because I got a lot of calls from patients who said they're there for their annual, and the doctor did a pap smear. However, they did not need a pap smear. And let's talk about all those, because not at every appointment do you need to have a pap smear.
Right.
However, there are guidelines set forth, which we will cover today, about what you should expect at what age, etc. So let's just talk about we talked about the pelvic and the speculum. Pelvic is basically just an exam.
Yes.
That's a visual exam. That's it.
With the speculum, but then a bimanual exam,
which is part of the pelvic.
We actually put our fingers in the vagina, check your uterus for any pain, cervical motion tenderness. We check your ovaries to see if there's any palpable masses, any abnormalities in the shape of the uterus. In which case, if we notice any of that, then we would, get an ultrasound and do further testing if we find anything abnormal during that exam.
Many times you hear people talk about, I have a tilted uterus. My doctor told me I had a tilted uterus, and that's something that they would see at the pelvic exam. What does that mean, Cheryl?
It just means that either your cervix is way far up or way far down. There's anteverted and retroverted uteruses.
So really,
there's retroflexed.
It just is a position.
It doesn't mean the uterus is in.
It doesn't mean anything ominous, which I think a lot of people misconceive that you have a tilted uterus to be something ominous or abnormal. It's just a position.
It's a variation of normal.
It's a variation of normal. Okay. So, good thing to take away from this. You don't have to call me because you have a tilted uterus. Pap smear.
Pap smear is just what I went over, the cells for screening for cervical cancer. If you're under 21, you do not need a pap smear, but that does not mean if you're sexually active that you don't need to come in annually to get STD testing. Once you're 21, that's when we start screening for cervical cancer. 21 to 29, every 3 years, assuming your first pap smear is normal, you don't need a pap smear for 3 years. However, you do need an annual exam You need the breast exam, you need the bimanual exam, you need the pelvic exam. You need all that because we're screening for abnormalities in the breast and the ovaries and the uterus.
I call this establishing a relationship with your
Right,
your
yeah.
provider, because they're going to note something when you get to start to see them when everything's good. That's the best, because when there's something that changes, that's where that relationship has benefited
right.
you, because you've had a relationship with this person. They felt this before on you, and they're like, well, this is different. Yes, they do remember. They do remember you, and they do remember when they're feeling when things are normal or abnormal.
And we document.
To
Yes.
help us understand.
Documentation.
Documentation is the thorn in our side.
Yes.
But also very crucial, because who does it benefit at the end of the day? You. Benefits you, and so we do it diligently. So, anything else you want to add about the annual?
The annual.
PAP?
Well, and yes, the reason why PAPs are not necessarily required anymore every single year, studies show that cervical cancer is very slow growing. So even if you tested positive, next year, like if you got your PAP and it's normal and then somehow you developed it next year, it's still very slow growing, easily treatable. However, ovarian cancer, breast cancer, not as forgiving. So that's why it's very important to catch those sooner rather than later. Those need to be addressed immediately, treated immediately, and taken care of immediately.
Well said.
So age 30 to 65 years old. We do pap smear with HPV testing at least every 5 years, assuming they are normal. We will do it more frequently if you have abnormal pap smears and do further testing and biopsies and stuff like that. And that's a different episode, but
Which we'll get to.
and your provider, based on your results of your pap smear, will advise you when you need to get your pap smear done again. But the takeaway from this is you still need an annual exam, whether they do a pap smear or no pap smear.
Yes. You hear what I'm saying to you. That's what I'm saying.
Cultures, STD testing.
Yeah. Cultures are, a lot of times you can have group beta strep on a culture. You can have lots of different bacterias that can cause problems in your vagina.
Sexually transmitted
diseases.
yeast, BV, bacterial vaginosis. If you are sexually active, you should have testing every single year, and that's in the next episode. We're going to go over all the different types of sexually transmitted diseases, what the signs and symptoms are, what you need to do, what your partner needs to do, all that, so stay tuned for the next episode. However, get your testing done because it can affect your fertility. If you plan to have children in the future, it can cause pain, it can cause pelvic inflammatory disease, whole slew of complications. So stay tuned to the next episode to go over that. But I do recommend screening annually, at least for gonorrhea and chlamydia at the minimum.
And trick. Do you screen for trick every year? Is that part of that? Or is that specific?
It's an add-on. It's an add-on. You can add it on to the culture.
Okay. That was
And there's other labs that you can get tested for, which is in the blood, that a lot of people don't necessarily think of every year, but HIV, you can get tested every year for HIV, syphilis, herpes, hepatitis. There you can test herpes, the genital outbreaks or the cold sores, and you can get tested for that in your blood, even if you've never had outbreaks. It just means you carry the virus.
Which again, we're going to go over in our special STD episode. Remember we're going to call that episode Let's Talk Trick. But seriously, we are talking about all sexually transmitted infections, and we'll get into as much detail as we can on each one.
To further go on with the annual exam, we also do a breast exam, of course. If you're over 40, don't be alarmed if your provider does a rectal exam. After 40, we do screen for blood in the stool, so it's a hemocult test for blood in the stool. And after now 45, I believe, is the new recommendation for your first colonoscopy. It used to be 50. They just changed it effective January this year. 2019. So make sure if you're 45 and over, make sure you get your colonoscopy.
Again, a screening. And your GYN or mid-level provider at that office may order that for you, but understand again, they can order it for you, but they are not experts in that area.
Right.
They'll order the exam. Same goes with sometimes you'll come for your annual and they order your mammogram, and they'll also order your bone density after a certain age, along with your colonoscopy. But they're gonna, if there's an abnormal that comes back on that, they're gonna refer you to someone who is a specialist in that area, because that's not a really. There's only so much we can do as a women's health provider. There are some things we can do and recommendations we can make and care plans we can get together for you, but once you're at a certain point, we will refer you somewhere else to someone who is a specialist in that area, because we are not.
We want you healthy. Sometimes people only see their GYN and they treat them as their primary care.
Correct.
Even though we aren't your primary care, but if you have anything abnormal, like we can do screening for your cholesterol and your sugar and stuff like that. We can screen for that. We don't treat that, but we can screen for it. And if we're the only provider you see, but we're going to refer you to someone else if you have abnormal cholesterol, abnormal sugar.
Establish yourself. Not only important to establish yourself with your women's health specialist, midwife, gynecologist, whatever, but 100% important to establish yourself with a primary care physician who knows not just, in other words, we just know your vagina, they know your entire body. And Cheryl, it's important for them to know too, we actually report our findings to your PCP. Like when we know, hey, this person has a PCP, send them the information for their PAP. They were seen in our office today, blah, blah, blah. Yes, we do correspond with your PCP so that they know you're doing what you're supposed to do as a patient. Being compliant as a patient is very, very important, which we will talk about more in other episodes. Patient compliance is really important. We can't be the only ones in your corner. You have to be in your corner too.
Yes. And your primary care can do an annual exam.
Yes.
It doesn't have to be an OBGYN. If you're very comfortable with your primary care doctor doing that exam, by all means, you can see them. If there's anything abnormal and you need a biopsy, they're going to refer you to a specialist to do the biopsy. And to finish up with the screening, if you're over 65, you don't necessarily need a pap smear anymore, assuming you've had normal pap smears prior to turning 65. If you've had a hysterectomy at any age, you've had normal paps and all that, you still need your breast exam each year and your mammogram each year. And if you still have your ovaries, if they didn't take your ovaries during that surgery, you still need a bimanual exam, because you're still at risk for ovarian cancer. So please know what your surgeon removed when they did your hysterectomy, because if they left your ovaries, you still need to get those taken care of and looked at and screened each year.
And speaking of screenings and touching on that real quick, I'm an advocate of continuing the care being consistent. And what I mean by that is when you go for a mammogram, if you went to site A, that is where you've always gone for your mammograms, go to that place. Unless you want to do the legwork to obtain your previous images to bring to the new place you're having images done. Why? Because they look at your old images and your new images and they compare them. If you're going to a new place just out of, it's convenient for you, whatever, and we respect that, you will have to get your previous images from the other health system that you were at so that the radiologist at the new health system can compare the two. If you don't do that, then you should be prepared to have further images. For example, they may see something in your breast tissue that's been there for the past 5 years that your other radiologist saw, but now you have a new radiologist looking at it, and now they're going to say, well, I want an ultrasound and an additional image of this breast to a diagnostic mammogram. And really, if you had continued where you were, that might not have been necessary. Does that make sense?
Definitely,
so,
absolutely.
That regular, consistent care is really, really important. And even, again, going back to your provider, doing the bimanuals, she knows what she felt last time. She knows what she felt this time. Is it different? That's why it's important to establish, I always say this, a relationship. It is a relationship between you two. You have to be comfortable with your provider. You have to be able to ask them questions, the most bizarre questions you wouldn't imagine asking your best friend, but you better be able to ask them to your gynecologist. You better have that trust between them, because that's important. You need to be able to ask them things you wouldn't ask your best friend. I don't know if you would agree on that.
Oh, definitely.
So,
Yeah.
So in the next episode, we're hoping that you will join us. We hope you found this informative. We have a lot more fun stuff to show you. We're going to talk.
Can't wait for our first Q&A. That'll probably be kind of fun.
Q&A. Send us questions. We want your questions. We look forward to your questions. That's where the fun's going to start for this whole thing. Men, your questions are important too. In fact, they may be equally as important as the woman's questions.
Yes. And you need to stay tuned, men. Stay tuned for our next episode. We're going to talk about sexually transmitted diseases.
Yes, and we're calling that episode "Let's Talk Trick."
Yeah.
And other STDs. Super fun stuff coming your way. Thanks for joining us today.
Hey, don't forget to please like and subscribe to our channel. That helps us to get all this information out to more viewers. So we would appreciate it if you like our channel, subscribe and watch, because there's more fun stuff to come. Let's Talk Trick next. Thank you for joining Wine Time with Women. For women.
Thanks for coming. Peace. Cheers.
Peace out. Cheers.